Bismillahirrahmanirrahim. In the name of Allah, the most gracious, the most merciful. I'm Dr. Mahnoor PGI in Department of Community Medicine, and today I'm going to present on the topic of postnatal care under the kind supervision of my supervisor, Professor Dr. Saira Afzal. In this presentation, we will learn what is the postnatal period, objectives of postnatal care, essential routine of postnatal care for mother, essential routine for postnatal care for newborns, postnatal visits, WHO recommendation, and recent updates. At the end of the session, my colleagues would be able to describe component of postnatal care and its importance. So what is postnatal period? The postnatal period, also known as postpartum period of the fourth trimester, encompasses the time frame following childbirth, typically extended for about 6 weeks. The phase marks as a critical and transformative period for both the mother and the newborn as they adapt to changes brought about by pregnancy, labor, and introduction to new life. Postnatal care. World Health Organization stated that postnatal care is defined as a care given to the mother and newborn baby immediately after the birth of the placenta and for the first 6 weeks of life. Majority of maternal and neonatal deaths occur during childbirth and postpartum period. Postnatal care, also known as postpartum or afterbirth care, is crucial phase in continuum of maternal and child health. It spans from at least 6 weeks. Postnatal care is designed to support and monitor the well-being of both the mother and newborn. Objectives of postnatal care: to prevent the complication of postpartum period, to provide care for rapid restoration of the mother to optimum health, to check adequacy of breastfeeding, to provide family planning services, to provide basic health education to mother and family. Essential routine for postnatal care for all mothers: assess and check for bleeding, check temperature, support breastfeeding, check the breast to prevent mastitis, manage anemia, promote nutrition and insecticide-treated bed nets, provide counseling and arrange options for family planning, counsel, and for the endanger sign. Danger sign for the mother: excessive bleeding, foul smelling, discharge, fever with or without chills, severe abdominal pain, excessive tiredness or breathlessness, swollen hands, face, and legs, painful engorged breast or sore, cracked, bleeding nipples. Here's the different types of postpartum psychological issues, which are postpartum blues, postpartum anxiety, postpartum obsessive compulsive disorder, postpartum panic disorder, postpartum post-traumatic stress disorder, and postpartum psychosis. Here, three are the most important: postpartum blues, postpartum anxiety, and postpartum psychosis, postpartum depression. Here's the brief summary of all. Postpartum blues are also known as baby blues. This affect the 50 to 85% of mothers. Symptoms last up to 2 weeks after the delivery. Symptoms could include mood swings, anxiety, sadness, irritability, crying, feeling overwhelmed, reduced concentration. Postpartum depression, it affects 30% of population. Symptoms can begin immediately and up to a year postpartumly. Symptoms could include depressed mood, severe mood swings, excessive crying, intense irritability, severe anxiety, difficult bonding with baby. You used to enjoy. Postpartum psychosis, it affects 0.1 to 0.2% of mothers. Symptoms begin in first 3 months of after delivery. Symptoms could include depressed mood, confusion, disorientation, obsessive thoughts, delusions, attempt to harm yourself and to your baby. It's the most important sign of postpartum psychosis. The transition to mother involves significant cerebral and psychological transformation. So all we are have to work as a teamwork on the mother. Should release her stressors. Should provide the family support. Should provide medication if needed. Essential routine for postnatal care for all newborns. Assess for danger sign, measure and record weight and check temperature and feeding. Support optimal feeding practices, particularly exclusive breastfeeding. Promote hygiene and good skin, eye and cord care. If prophylactic eye care, it is still effective until 12 hours after birth. Promote clean and dry cord care. Identify superficial skin infection and refer baby accordingly. Ensure warmth after the first 24 hours. Practicing skin to skin care and putting a hat on the baby. Encourage and facilitate birth registration. Refer for routine immunization counsel for endangered sign. So what are the endangered signs for the newborn baby? Convulsions, movement only when stimulated or no movement even when stimulated. No feeding well, fast breathing, fever, low body temperature, very small baby or bleeding. So how we describe the postnatal visits to the patient. First contact, if the mother is in a facility, she and her baby should be assessed within 1 hour or of birth and again before discharge. Encouraging women to stay 24 hours, especially after a complicated birth, should be considered. If birth occurs at home, the first visit should be targeted crucially in first 24 hours. Follow-up contacts are recommended at least 2 to 3 days, 6 to 7 days, and at 6 weeks. Extra contacts or follow-ups are recommended for babies needing extra care. If babies are with low birth weight or mothers are with any comorbidity, then extra visit will be required. WHO recommendations. Provision of postnatal care to mother and infant. Recommendation number one is timing of discharge from a health facility after birth. It should be within 24 hours. In second, number and timings of postnatal context. If it is happening in a health facility, then discharge will be after 24 hours, and if it is at home setting, then first visit should be done within 24 hours, and should also be visited in 48 to 72 hours. Recommendation number 3 is home visits for postnatal care. Baby should be assessed by pediatrician. Exclusive breastfeeding should be encouraging. Cord care is the most important thing in home deliveries or in tertiary care setup deliveries. Other postnatal care for newborn are bathing should be delayed until 24 hours, appropriate clothing of the baby. The mother and baby should not separate, should stay in same room. Communication and play with the newborn should be encouraged. Immunization should be done. Preterm and low birth babies should be identified immediately and should be managed accordingly. Next is the postnatal care for mother. Actually, first 7 recommendation of UHS belongs with the neonatal care and onwards are associated with the mother care. So first 24 hours after birth, our postpartum woman should be regular assessment of vaginal bleeding, uterine contraction, fundal height, temperature, and heart rate. Blood pressure should be measured shortly after birth. Urine void should be documented within 6 hours. Beyond 24 hours, at each subsequent postnatal contact, inquiries should continue to be made about general well-being and assessment made regarding the following: micturition and urinary incontinence, bowel fluctuation, healing of any perinatal wound, headache, fatigue, back pain. Breastfeeding progress should be assessed. At each postnatal contact, women should be asked about their emotional well-being to rule out blue baby psychosis or anxiety. At 10 to 14 days after birth, all women should be asked about the resolution of mild transitory postpartum depression. Women should be observed for any risk. Women should be told whom to contact for advice and management. All women should be asked about resumption of sexual intercourse and possible dyspareunia if they are and if there is any issue or concern of any postnatal contact, the woman should be encouraged. Most important is the counseling. All women should be informed about the psychological process of recovery after birth and that some health problems are common, with advice to report and health concern to healthcare professional. uh, for example, postpartum hemorrhage, pre-eclampsia, sign and symptoms of infection, fever, shivering, abdominal pain, sign and symptom of thromboembolism, all should be explained. Postnatal care for mother, women should be counseled on nutrition, should be counseled on hygiene, especially hand washing, should be counseled on birth spacing and family planning. Contraceptive options should be discussed. In pandemic, mothers and babies should be in malarial pandemic, there should be a preventary method should be explained to the mother. All women should be encouraged to mobilize as soon as appropriate after the birth. That should encourage the gentle exercise and make time for themselves. Recommendation number 10 includes iron folic acid supplementation even after the delivery. Prophylactic antibiotics should be taken if instrumentation is done, and psychological support. The all concerns regarding psychological support should be discussed with the patient. Now we will move towards the recent updates. Kangaroo mother care. Every year, more than 20 million infants are born weighing less than 2.5 kg. Over 96% of them is in developing countries. These low birth weight infants are at increased risk of early growth retardation, infectious diseases, and developmental delay and death during the infancy and childhood. Evidence suggests that kangaroo mother care is a safe and effective alternative to conventional neonatal care, especially in undersourced setting, and may reduce morbidity and mortality. This should include early continence and prolonged skin-to-skin contact between mother and child, frequent and exclusive breastfeeding, early discharge from hospital. WHO recommendation regarding kangaroo mother care is to routine care of newborns weighing 200 gram or less weight at birth should be initiated in healthcare facility as soon as newborn are clinically stable. Newborn weighing less than 200 gram 2 kg birth should provide close continuous kangaroo mother care as possible. Intermittent kangaroo mother care rather than conventional care is recommended for newborn weighing 2 kg or less weight if continuous kangaroo mother care is not possible. Benefits of kangaroo care to baby: stabilize your baby's heart rate, improve your baby's breathing pattern, improve oxygen saturation, gaining in sleep time, experiencing more rapid weight gain, decrease crying, having more successful breastfeeding episode, having an earlier hospital discharge. Improve bonding with baby, increase your breast milk spray. It's all the benefit for the mother. Increase your confidence in ability to care for newborn. Increase your confidence that your baby is well cared for. Increase your sense of control. It is the second study, WHO recommendation for breastfeeding mothers in COVID-19. WHO current guidance is that women with COVID-19 can breastfeed if they wish to do so, but they should take precautions, including practicing respiratory hygiene during feeding, including wearing a mask or covering mouth and nose, washing hand with soap and water for 20 seconds before and after touching the baby, routine cleaning and disinfecting surface they have touched. Here's the third study, which focuses on the postpartum depression management. A descriptive cross-sectional study designed using a quantitative approach was used to for study the study population included mothers and healthcare workers. Postpartum depression was prevalent among 7% of all mothers selected. The severity ranged from minimal depression to severe depression. The most common intervention used in management of postpartum depression among respondents were psychological support. Psychosocial support proved to be the most effective intervention that has been used by healthcare workers to reduce the depressive symptoms. Postnatal care, pre-discharge, and post checklist. This point of care, postnatal care, pre-discharge checklist, and well poster is extended for use by healthcare providers, educators, and other postnatal care stakeholders. Originally published in 2016, and postnatal care checklist and poster have been updated to include recent clinical recommendation. And it is the poster where for all mothers and newborn, the checklist is provided, and a mother with any of the comorbidity and a newborn with any of the comorbidity is discussed. It is one more study which shows the low utilization of postnatal care, searching the window of opportunity to save mothers and newborn lives in Islamabad, capital territory, Pakistan. Each year, an estimated of two, 289,000 maternal deaths occur worldwide, of which 50% of maternal deaths occur around labor, delivery, and immediate postpartum period. Postnatal care is crucial but relatively neglected component in the continuum of care, and hence a missing link towards safe motherhood. Despite the significant improvement in child health and safe motherhood intervention, maternal mortality ratio, perinatal mortality, and neonatal mortality still remain a challenge in achieving a Millennium Developmental Goal 4 and 5 in Pakistan. Many countries still have a high maternal mortality ratio, 300 to 499 deaths per 1 lakh live births, and the timing of maternal deaths is clustered around labor, delivery, and immediate postpartum period, extremely high on the first and the second day after birth, according to Pakistan Demographics and Healthy Survey 2012 to 13 report. About 73% of women are seeking antenatal care. 48% of deliveries are conducted at health facility. Around 60% of women receive postnatal care for their last birth within the first 2 days following delivery. However, from second day onward, the percentage of women seeking postnatal care declined significantly. Among women who had postnatal checkups, 54% received postnatal care within 4 hours of delivery, 5% came within 4 to 23 hours, and 2% out if there is after 1 to 2 days. The rest never had any postnatal care checkup and believe that it is not necessary to seek postnatal care. This was our descriptive cross-sectional study carried out in 4 union councils of Islamabad capital territory to understand the determinants of postnatal health care seeking. The study sample comprised 225 postpartum women with a child 0 to 1 month of age, and healthcare providers from both public and private sector. Only 30% women received postnatal care, amongst which 68% went to government health facility. Now the time of MCQs. Mr. Ali delivered our first baby through cesarean section. Mrs. Ali. After 6 hours of section, she developed sudden headache, blurring of vision, epigastric pain, and convulsion. What will be the diagnosis for her presentation? A. Preeclampsia. B. Puerperal sepsis. C. Eclampsia. D. Postpartum hemorrhage. E. Epilepsy. Anyone?
C.
The answer is C. A baby is born at home in setting with high infant mortality. Which of the following is recommended for the first week of his life? A. Chlorhexidine. B. Dry clean cord care. C. Fusidine cream. E. Ethyl alcohol. E. Chloramphenicol.
A.
Yes, the answer is A. A young lady after delivering a baby developed severe mood swings, excessive crying, loss of appetite, insomnia, and difficult bonding with baby. Which of the following intervention has been proved to be most effective for this condition? A. Psychosocial support. B. Postpartum home visit. C. Interpersonal psychotherapy. D. Cognitive therapy. E. Isolation.
A.
The answer is A. Psychosocial support. A baby was delivered weighing 1.8 kg and vitally stable. He was put on to his mother's chest by a lady health worker right after delivery. The benefits of kangaroo mother care are all except um breastfeeding, A. Breastfeeding, B. Thermal control, C. cord care, E. Early discharge.
C.
The answer is yes. MCQ number 5, kangaroo mother care is a simple method of care for infants that include early and prolonged skin-to-skin contact with their mothers. Which babies are eligible for kangaroo mother care? A, very sick baby. Uh, B, all low birth weight babies. C, all stable low birth weight babies. D, all newborn babies. E, all mothers and babies.
C.
Yes, the answer is C. MCQ number 6, mother exclusive breastfeeding her 4-month baby developed fever, cough, SOB, loss of taste and smell. She was then diagnosed with COVID-19. What are the WHO recommendation in this case? Uh, A, to stop breastfeeding and start giving baby complementary food. B, to stop breastfeeding and start bottle feed. C, to continue breastfeeding with precautions. D, to continue breastfeeding without precautions. E, to consult a pediatrician.
C.
Yes, the answer is C. Uh, Postpartum blues, also referred as baby blues, is the most common type of postpartum mood disturbance occurring in approximately 70 to 80% of all mothers. Its onset is usually shortly after birth and it's generally resolved within dash days. A, 3 days. B, 10 days. C, 30 days. D, 15 days. E, 6 weeks.
E.
The answer is B, 10 days. Mr. and Mrs. Salim were called by their gynecologist after delivery of the baby to adopt a suitable method of for next birth. Which of the following method is not recommended in postpartum period? A, intrauterine device. B, non-hormonal contraceptive. C, combined oral pills. D, medroxyprogesterone acetate. E, barrier methods.
C.
The answer is C. COP is. And so now, soon after delivery, the health checkup of mother must be frequent till the end of 6 weeks. Which of the following is necessary to examine by the end of 6 week? A, fundal height. B, stitch line. C, HB level. D, A and B. E, blood pressure. Answer is A. The primary gravida delivered a healthy baby through spontaneous vaginal delivery. After 6 hours, she developed excessive pre-vaginal bleeding, leading to shock. What could be the possible cause of her postpartum hemorrhage? A, retained placenta or membrane. B, anticoagulants taken during pregnancy. C, bleeding disorder. D, perineal tear. E, psychosis.
A.
Yes, the answer is A. Here is the MCQ key. These are the references. This is the link of our YouTube channel. Kindly like and subscribe. Thank you.